In this show, we often talk about the metaverse and how to stay secure on Web3. However, when it comes to securing their systems, most major IT companies across the world have a code red, which is a plan that their IT administrators bring into effect in case of major security-related attacks. Just like Web 1 and Web 2, this code red is soon going to be a thing of the past because PCs protected by Intel vPro don't need to worry about these threats anymore. It helps defend against attacks before they even happen, thanks to the built-in multi-layer security. Time to cancel the code red. Intel vPro, built for business. Hi, welcome to Future Proofing. I'm your host Ekalavya, and this show is presented by Intel vPro, built for business. Today's episode is about healthcare and medicine, and we have a very special guest today. Joining me is Dr. Pawan Rane, a head-neck oncosurgeon, an entrepreneur, and also a tech evangelist. Join us on the other side of this quick Intel vPro break as we discuss robotics, computer vision, AI diagnostics, what the metaverse has in store for patients in the future, and lots more.
Hello. It's been another great week on the IVM Podcast Network. On the Wired Talks, Siddharth talks to former Secretary General PDT Achari, who sheds light on words being banned from usage in Parliament. On Cock and Bull, Cyrus, Ayushi, Akash and Antarish discuss the controversy surrounding Smriti Irani's family restaurant in Goa. On The Habit Coach, Ashton speaks about how a nursery rhyme can be surprisingly inspirational for adults. On Think Fast, Varun and Suchita throw light on the rise in investments in plant-based meat. And on the Life Manifesto, Zarina helps you identify energy vampires and gives you tips on how to deal with them. Once again, everybody, remember we have amazing merchandise available. You can go to ivmpodcast.com/store or go to our website and you'll be able to see the link. Do check this out. Do buy some stuff. It really does help us out. Do remember, follow us on social media. We're IVM Podcast on Twitter, Facebook, Instagram, and LinkedIn. Also, if you're enjoying this show or any of our other shows for that matter, please do tell a friend. Remember, if you do tell a friend about a show and they listen to the show, you'll have somebody to talk to the show about. We'd really appreciate it also if you could give us a rating on whatever platform you're listening to us on. And finally, do remember we're also available on YouTube. A number of our shows are available as full video shows, but every show is available on YouTube. And finally, we'd like to thank our sponsors this week, both Lifestyle, Small Case, Capgemini, and Intel vPro. Thank you so much for making this possible.
Hi, welcome back. In the studio with me today is Dr. Pawan Rane, an exceptional head-neck oncosurgeon. He studied at Tata Memorial and also at Sloan Kettering Cancer Research in New York. Thank you for being here, Pawan, and welcome.
Thank you for having me on the show, Eka. I'm glad to be here.
Pawan, while growing up, of course, you have two choices, right? Like we had two choices when we were young. It was either medicine and technology. And I think both of us were slightly in that hybrid. Not many people know that I actually studied biotechnology. But you, for me, have always been a doctor who loves his technology.
Correct.
So tell me, where did this love for technology come in? And of course, a question which I ask all our guests, right? Tell us a little about your first memory of the internet.
Well, I have always been a person who was interested in machines and interested in technology. I wanted to explore new things, read new books on technology, and then comes the internet. First memory was when I went out with a friend to a cyber cafe, and then you realize this is a vast resource where so much things are available. Yeah, you're right. There are two options, engineering and medicine. And if you're eligible for medicine, there's pressure to go into medicine. And I had a thing for medicine as well as my as a person who also likes technology. So that's how I entered into medicine. But technology has always been my thing. And So growing up, as you entered medicine, you see that this is a huge domain where there's so much information, there's so much to learn. You explore a lot of things on your medicine as well as you learn so much things outside medicine and the future, what is future going to hold, all that. So it was exciting, few years where you learned so many things, right?
So fascinating, right? Like internet as a resource. I remember in college, a lot of stuff which if you were curious, the internet was your go-to, right? Like especially like so much one could get access to research papers, etc.
Absolutely,
Like
absolutely.
I'll tell you when I was in college, you know, CRISPR was a big thing, right? And that's what probably got me into studying biotechnology, and it was everything about genetics and genetic splicing, and suddenly like I could see science fiction come into real life. And the field of medicine and healthcare has seen crazy evolution with technology over the last 15-20 years, right? So tell us a little more. Tell us things in this space which has really excited you and you've seen over the last few years, probably robotic surgery, AI detection of diseases. Tell us more.
Yeah. So now medicine is evolving because health is finally wealth. So that's the most important thing for most of us. And as information and data is accumulating on the internet, as well as latest technologies in genetics, latest technologies in robotics are evolving, it's going to be an exciting future where there'll be so much more to do. In genetics, like you said, CRISPR, now your ability, you can really edit genes, and you can create a completely new person which will not have these genetic defects which he has previously. With robotics now, I myself am a robotic surgeon. I have
So you studied in Korea, right? You studied robotic surgery.
Seoul National University Hospital. Okay. That's a place where I trained in robotics. The surgical robots are now a thing which is going to be commonplace, and the operative work is becoming more and more well defined, and the complication rates are going down. So robotics is going to be one of the future things. It's going to be exciting. The thing about robots is it can be controlled from a little distance as well. So recently, a few years back, there has been surgeries where the surgeon was not available in the place, and the person operated from a different country. So if we have a adequate enough fast bandwidth, now bandwidth is an issue, but if bandwidth can be done properly, then you have real-time surgeon operating from England to China, that far away. So it's going to be an exciting future in medicine.
That's fascinating. And we'll talk a little about how COVID basically got a lot of doctors also to evolve. But a little before that, right? Like I want to draw up probably Web 1.0 before probably during medicine was using the internet for research papers,
Correct.
finding out people.
So,
and then Web 2 came in, right?
Correct.
Web 2 was when social media came in.
Correct.
Tell us a little experience of yours, Web 2, social media and
right
medicine.
From Web 1, Web 1 is still a go-to resource for most medical professionals, because a lot of the research work is just you go, refer, you come out. That's it. But with the evolution of social media, with the evolution of all these medical apps, there have been interactions. There's patient-generated data, there's user-generated data. All this is interacting and, building new things. So Web 2 has been exciting with a lot of medical apps coming in,
Tell us some which you like. Tell us some which you don't like.
So there are variety of apps. So like let's say Practo. Now Practo has brought the ability to connect to different doctors. You can identify which doctor do you want, and you can see their reviews. You can see their ratings. It has democratized things in a particular way. Otherwise, what you used to do earlier, you used to ask your neighbor, ask your father, ask your relative, which doctor do I go to?
Especially if you're a new city, right?
And you don't know
people,
you don't know where to go. Now you know which doctor to meet and how to meet. And with, like you said, COVID, things have opened up, because there was a resistance to, go and meet a doctor online or consult a doctor online. Doctors themselves were very resistant to talk to patients online. But something was forced onto them because of COVID. And now they are connecting, and it's become a little more open to talk to patients online and, give them information online. It has its pros and cons. There are things which you can do online, things which you can't do online presently. But like even for Practo, there have been instances where patients have gone and given wrong reviews and given wrong ratings, and purposely just to violate the doctor.
That's a thing, right? Like I was reading, a lot of doctors do not like the whole ratings and reviews system, right? Because they feel that if a patient because of no fault of theirs, right?
Correct.
Like something happens to the patient, usually there's so much of hate towards the doctor which can translate online, right?
See, there are things which it's not in control of a doctor. Like, you perform a surgery, there are things which can go wrong. There are documented complication rates throughout the world. And if a complication occurs without any fault, still the doctor is blamed, because the people in India are still not aware that things can go wrong, and they tend to blame the doctors. Now, even billing issues in the hospital, the costing issues. Patients are very money sensitive in India, so they don't easily agree to high costing procedures. And when that thing happens, they tend to go to social media and vent out. The thing about doctors is that we also have a guideline where we cannot go online and advertise ourselves.
Yeah, that was part of the whole culture, right? But now that's evolving, changing
to a certain extent. But there are again rules and regulations to a certain extent, because doctors can defend themselves in publicly. So if anyone goes and says something, there'll not be a doctor replying, say, I did not do that way. So you'll never see this happen, because that's how we are not supposed to go online and not supposed to write. Whatever is online, that's online. Then you defend it at a place where it is meant to be defended at. So maybe if it's a court of law, if it goes into. But in the social sphere, anything can happen. But having said that, there is room for you having your own portal, because it's your own portal, and somebody who wants to check you up will come and check you up. You cannot advertise on an advertising portal, but you can be on your own portal, and if somebody wants to find you, then they can find you. And that's actually made it very good for patients to find you. Suppose you have your own portal where you are showing what are your expertise and what do you do, and somebody is looking for a person who has this expertise, he can actually find you. That's actually
true,
pretty
right?
good. Yeah.
And also, if you see distribution of medication online, right? Like and that's when a lot of these pharma companies have come online, right? And I wouldn't say pharma companies, but pharma distribution companies, right?
Correct.
And I think that must have definitely saved a lot of people who are in probably areas where it's inaccessible to get a certain medication. I'm sure that's helped. And then we've seen this influx of what you rightly said, right? Like finally health is wealth.
Correct.
And people are realizing that. So the number, so we had Addy in our previous episode, right? And he also mentioned about his favorite app being a health app, right? And we've seen this constant focus of health and nutrition coming in. Why is that happening? Because of more information? Like, why are we on this wave? Why is finally health is equal to wealth?
So, first and foremost, now it's a connected and aware patient. And because patient is evolving, the doctors also have evolving, because you cannot just stay like, the patient can go and check his own symptoms online. He can find out what are things which can be wrong with him. It is a plus and minus thing for us doctors when a patient comes and tells us that this is my diagnosis, you treat me like this. But at the same time, it's really good, personally speaking, when a patient knows what he's talking, because if he's read what can be done, he also knows what can go wrong, what are the things which can, what to expect from this particular, treatment.
True.
So that way, a person a well-informed person is very good for a doctor.
Okay.
That's.
But that's a fine line, right?
Yeah.
Because what has happened right now because of the internet and WebMD and a lot of such resources online, I think a lot of people have become hypochondriac, right? Like they automatically they feel, the smallest thing happens.
Correct.
Maybe your ear is ringing in the morning,
Correct.
and then you're googling, and then you're thinking that.
A thing about internet is that it'll show the most critical problems right up front. So
and suddenly everyone thinks they have cancer.
Just say I have abdominal pain, the first thing which pops up is stomach cancer, and you're like paranoid. Then now what if I have a cancer? So that's one of the things which forces patients to take wrong decisions and do wrong things. But if a person is fairly level-headed and wants to understand his condition in detail, he can really find tremendous resources, and he can learn so much about his own condition. He can figure out what works, what does not work, whether his doctor is actually doing the correct thing. So, okay, another thing which there's a guy called Eric Topol. If you've heard of him, he's a author and a cardiologist from US, and he's written a book called as The Patient Will See You Now.
Okay.
So if you've heard a dialogue that the doctor will see you now.
Yeah.
So, the next evolution in this is where the patient is going to be sitting in a room and then, he can choose what his doctor is, and, he's going to come and he'll see you and he'll decide what he needs to do further and what can be done further.
Yeah.
So,
Fascinating.
yeah. And that's, I think, the next stage of evolution, and it's already here. It's spread out to certain places where it is already happening, certain places where it is completely rural. And in India, I'll say that things are a little slow, but it's picking up. There are places where things are moving up now with metaverse and Web 3.0. Like recently there was been a hospital which is now on the metaverse.
Yeah, Yashoda Hospital we were reading, right, in Hyderabad.
Yes.
So we'll go ahead.
Yeah. So coming online, it has a lot of implications now. There are certain patients who do not want to go in front of a doctor and talk to him about their problems. There are problems which they are not easily able to communicate. So
what are these? Are these mental health problems, sex-related problems?
Yeah, sexual problems, maybe certain problems where they are not comfortable talking to. So when you have a neutral person on a metaverse platform, like a virtual hospital or a virtual doctor who you can explain your problems with, and
help us visualize this, Pawan. So what does the metaverse mean to you? And let's jam on how a metaverse hospital might look like, right? And who are these people who'll come, right?
Mm-hmm.
Like.
So what I see is, metaverse is the future of healthcare in certain domains.
Okay.
It's in certain domains only because.
But what do you mean by that?
Because when a doctor assesses a patient, I'm talking from the doctor perspective.
Yeah, for sure.
We don't look at a patient. We look at patients in different ways. So first is their history. So when they explain certain things to us, that is what is important. We find out what is important, what is not important, what is there, what is not there. Then comes the examination. So examination has 4 components. So we have inspection where we see, then we have palpation where we touch, then we have something called as percussion where we, percuss on the patient, and then with the stethoscope we auscultate.
Okay.
Now all these things cannot be done through metaverse. Okay. There are certain things which can go. So inspection, history taking is excellent. So in mental health, now there are algorithms which can detect your emotion on your face, it can detect based on your voice, your body movements it can detect. So it can diagnose you just on you being online in a metaverse. So
what is this metaverse? In a AR, VR world you're talking about?
VR
okay,
world,
sure.
Yes.
So how is this diagnosis happening?
So now there is an interesting algorithm which is developed by a company called Neuralogix.
Okay.
What this algorithm is doing is with computer vision, it's detecting your vitals, it's detecting your heart rate, it's just by your selfie camera.
Okay.
It's detecting your now the next evolution in that is it's going to detect your blood sugar.
Okay.
It's going to detect your bilirubin and cholesterol. So
through a photograph.
Through
just training an algorithm with AI based on.
Yes. So it's a cloud algorithm. You just have to put your selfie cam, look at it for a particular while, maybe a minute or 2, and it then will give you all your parameters.
Accurate?
They claim to be accurate, but then it's a starting point.
It's a work in progress.
Yeah. So you get that maybe something is wrong with you, then you can go and get yourself checked from an actual person and get it tested more thoroughly. But it's a starting point. At least you'll know that maybe something is wrong. Now I need to check myself further.
Oh, that's interesting. So so you are a young dad, right? You have a 6-7-year-old, and I remember when we were kids, we used to have general checkups as kids once a month, once a quarter. Mm-hmm. So do you see your kids' general checkup happening in the metaverse in the future?
Right. Metaverse independently will not do everything, but with the Internet of Things, which are health Internet of Things, where there will be devices which will measure everything.
All connected.
Suppose you sit on a chair which has all the electrodes and all the sensors, and then you're in a metaverse. You are talking. You're speaking to a person. all the information is gathered. So when you get all this information, then you'll able to, I see this happening in the next maybe 10, 15 years. You'll have this,
for sure.
Yes, definitely.
I've seen currently a lot of AR, VR technology is also being used in physiotherapy, right?
Mm-hmm.
Like try to explain to us what does that mean?
Physiotherapy is one of the domains where, you need to learn certain exercises.
Yeah.
Now, when you're in an AR, VR platform, there will be a teacher who will teach you how to do this exactly. And there will be a way to mirror it, the way to learn it, how to do it correctly, and what are you doing wrong. All that can be shown on that platform.
You're saying, is it going to be more immersive than doing this on a regular video chat?
Yes, definitely. And as a human being, I think we are looking for more reality. When you're looking at video, there's a screen.
It's a video, yeah.
It's a screen in front of you. So when you are in an immersive metaverse where there is feeling of reality in it, so definitely your whole perception of that thing will change, and it will actually make a difference. Now in mental health also,
that's a big topic, right?
There are people now, there are already existing things where you go and calm yourself. So you're like literally sitting on a seaside, you're in your room, but you're in the metaverse, you're sitting on a seaside, you're imagining the waves, you're listening to the sounds, it's calming you down. So there are a lot of stress relieving softwares which can do this for you. Meditation softwares which are in the metaverse. So the future is going to be
This sounds
very
fantastic. So let's shift a little from the metaverse and look at Web3 and blockchain in the health space, right? Whenever one speaks about Web3 and healthcare, one of the first things which comes up is privacy. Right? And data, right? Data and privacy.
Correct.
And maybe not India, right? So I want you to first explain to us, what is this obsession about patient data and privacy, especially in the US and Western European countries where we see a lot of conversation around this, and leading to, it doesn't matter to the Indians, right? And that's what I really want to know, because patient data privacy is something which I've not really heard even doctors chat too much about, right?
So I think first and foremost is collection. So are Indians actually collecting data? So I think there we are also slow. So, data collection is not happening adequately. The amount of data which needs to be captured properly, it's not happening. Then is whether the data can be stored somewhere, whether is it important to you. In a society like US where they are, in more advanced, they will definitely not want certain sensitive data to be in the public domain. In India, we are very price sensitive right now. We are not reached that economic standard where we can actually worry too much about our data. So as of now, in big hospitals, data is maintained very properly. But as you go to the periphery, it's just files lying in front of you, and you three patients at the same time sitting next to each other, each one knowing each one's diagnosis and being examined together. So that kind of situation in the rural setup. So,
but why is this data? Why are people worried about their patient data? Because they feel it might get stolen, they might get ads based on it, or hospitals might sell it to insurance companies, pharma companies.
Correct. The data, if captured adequately, can be used to do a lot of things.
You're saying good things as well as bad things.
Okay. So the good things is that, let's say just in COVID now, if you were having data privacy, and absolute data privacy, where there is no, unless you say so, nobody knows what is wrong with you. And suppose you get COVID, and now you're a COVID person, you can infect 20 people.
Yeah, you're a threat to society.
So then
right?
how
you were a threat?
Yeah, how does a person maintain that privacy? So absolute privacy is not good for the society, because when the data is not out there, it cannot be analyzed. You cannot make preventive things happen. You cannot make futuristic things happen. You cannot analyze it and say these were the things which are wrong. You cannot come up with new solutions to problems. When it is open, this can happen. So according to me, the future should be a balance of Web 3.0 blockchain, and there should be a balance of ability to give your consent to share your data. So I will say there's a concept called anonymization. So anonymization means your data, you remove the identifiers. if your name and certain things about you are removed from that data becomes a neutral data. It cannot be linked to you. That data can be used for purposes, for public health, for research. So that data should be in the open domain. That's my thinking. But if you have certain data and you want to do something about it, and then there are agencies which are looking for specific data from you. Suppose you are a certain cancer patient, and you want to somebody is looking for that rare cancer and says, "Ki, if you give me your information, it will help us to get develop more vaccines. Can I buy that information from you?" And you should be able to sell it to him.
So you're saying a world where patients are also aware of where their data is going to be used. Pawan, on that note, we'll quickly jump to the segment which I do on my show. It's called Eka's Commandments for Future Proofing. Much like in life and the real world, there is a need for stability in the virtual world too. From where we stand, much of Web3 is still a future that is developing and evolving. However, I do know that a more stable future is coming. Stability is the key to long-term success, and Web 1.0 and Web 2.0 grew not only larger with every passing day, but also more stable and secure. Same is going to be the case with Web 3 in the years to follow. But if you truly want to future-proof yourself towards a stable user experience, we suggest you check out the Intel vPro line of processors. Enterprise users would understand the importance of stability when it comes to scaling and managing a PC fleet. There are always a number of updates coming out. The Intel vPro platform gives IT and end users the stability and reliability of a business-class device with the help of the latest PC platform technologies in one integrated and validated solution. Intel vPro, built for business. Hi, welcome back in this fascinating conversation of Web3 blockchain when it comes to healthcare and medicine with Dr. Pawan Rane. Pawan, just before the break, we were talking about data privacy, patient privacy, and you explained to us why it's important and how can it be utilized. So in a very theoretical way, right? Please continue, but I also want to know a little about what's happening in India.
Correct.
Right?
So I wanted to bring that up in terms of data privacy. Now, Indian government has drafted a policy. So Digital Information Safety in Healthcare Act. So
it's called Disha, right? Okay.
Disha Act. So this particular act is going to now manage how the patient data is going to be handled in India. So there's going to be something called as a National Electronic Health Authority, which is called as NEHA. I know that name. And there is a state authority called as SEHA. So these authorities are supposed to handle and control how the health data is going to be. So there's going to be an universal health identifier card in India very soon. That's the plan.
It's like an Aadhaar card?
Yeah, similar to that. And that data will be, all your health data should be linked to that particular card. And then what happens is that, you can move from one institution to another. You can move from one doctor to another. And your information is linked to that particular card. So it becomes very good to, gather all your data. Because what happens as you must have seen yourself, you go to one doctor, you do something, and then you go to another doctor, you do something. These two doctors don't communicate each other, and your information also is not gone from this side to that side. It is harmful for you itself because maybe he's given you some medicines, maybe you've taken certain medicines from here, and there is an overlap of medicines. So
maybe some medicines you
which
are allergic to.
Yeah,
exactly.
So information is very diffuse in India.
Okay.
And information not captured in India, and information, even if it's collected, is collected in hard copy. So that's where blockchain, I think, would be brilliant. It'll capture data, it'll keep data in your particular way.
Immutable, right? Like that.
Immutable.
That's one thing which is important in India.
Yes.
And I was just going to talk about that, right? Like for vaccination records, right? And since it's COVID, let's talk about it, right? Like there are some anti-vaxxers, right? Like led by Novak Djokovic, and you're a sports fan also, right? And like I'm a big fan of Chelsea, and Kante is again an anti-vaxxer. I don't like that much, but again, to each his own, right? But now what happens is if someone's work is associated with their vaccination status, maybe that's a reason for them to lie about the vaccination status, right? And in India, out of all countries, I know I won't say it's easy, but it's possible to get a fake vaccination certificate, right?
True.
So I see blockchain technology when it comes to security and especially immutability, right? Which means like if your vaccination record, right, from a pediatric level, right, your vaccination records are always existing, not on probably a file, not owned by probably one institute. Maybe if it's a government institute, okay, fine, right, with the trust angle of it, and probably what you were saying is somehow this becomes like a digital token Aadhaar, and from doctors to doctors a API can be built, so whenever you're going to a new doctor who wants to see your history, they can just plug this in and with your consent probably actually get to know your data, right? Theoretically that makes a lot of sense, right?
Correct.
Will it happen?
So again, to put it theoretically, this can work perfectly well in a very utopian kind of a world where everything can be done properly. But in India, right now at least, like you can go and buy medicine just off the counter. You can let's say this whole
prescription
drugs can be just bought off the counter.
Okay.
Let's say you finally manage to build a blockchain where this particular medicine can be purchased only by this particular person, and but then you cannot guarantee that person is the one who is taking it at the end. So it can be taken by, he can buy it for someone else.
Okay.
So there can
that
be,
makes sense.
yeah.
Right?
So
like
there can be problems. There are things where things can go wrong still in a field like this. But you need people also to evolve to actually want that everything goes properly. So
let me try to break down what you just said. So on a blockchain technology for supply chain management when it comes to drugs, right, for pharma companies, you're saying blockchain technology can be a great tool to ensure that drugs don't get abused, counterfeit drugs don't come in, and what you're saying is to the level of every bottle or every tablet strip, you can get a detail right from when it was manufactured, where was it stored, to who's bought it, right?
Correct.
That kind of data
this can actually happen, and this is very much possible right from the manufacturing to the end dispensing. It can be, the logistic chain can be perfectly put in blockchain, can perfectly put in in a way where you can exactly trace where it has come from and who has taken it. So that can be definitely done. But the end, it's up to the user how he uses it, and whether he's purchasing it for himself. Somebody buys a prescription
but at least there'll still be a record, right?
There'll be a perfect record, yes. So this is the next evolution which can happen.
Even if an enforcement agency comes in, at least they have some basic data on who's bought what, etc.
Absolutely.
Pawan, next I'm going to talk about something again in this space which not a lot of people like to talk about, right? So India is a jugadu nation, right? We've seen a lot of movies where people find some sort of jugaad to make money in India, right? And I was reading about how blockchain technology and Web3 can really revolutionize the insurance space in India, right? Especially health insurance. And now I think over the last few years, health insurance has got some mileage. A lot of people are talking about it. People see the benefits of it. But when a lot of people start talking about it, you realize that a lot of people realize that here's an easy way to make some money, right?
Yes.
So I want to understand what is this insurance fraud which is happening in our country, and probably again in this utopian way, how can this be fixed, right? So what do you think is the problem which is now being seen in this space?
In the bigger places, in the metropolitan cities, this problem is slightly lesser.
Okay.
But as we go to the periphery, there are people who actually manipulate the insurance. So
what do you mean by that?
So what they do is, this is one thing which I've heard has happened at a certain place. The person, the middleman, goes to a rural area and purchases insurance for all of them. Let's say 100 people, he purchases insurance for 100 people.
In a village.
He does it himself on their name.
Okay.
And then what he'll do is he'll go to the hospital and he'll say, ki, this particular patient will come and get admitted to your hospital and get discharged. Just show that this procedure is done, claim this insurance. So this is what has been happening in certain places, and this is a pure insurance fraud. Now, with the blockchain, and with the health token, with the patient identifier, if this particular thing has been streamlined, like you said, in a utopian world where everything is perfectly done, then I think this will solve almost all of the insurance problems. But like you said, India is a jugadu nation. There are ways to get around everything. So so that's what I said. People need to evolve to actually become a little more aware and see whether that particular thing is helping them or no. We are very price sensitive, so we will.
No, but if someone was to do something in this space, right? Who do you see taking the lead? Do you see insurance companies taking the lead because they are facing losses? Do you see a government initiative like we saw with Ayushman Bharat and all, where finally a lot of people, like you told me that Maharashtra government already had a health insurance scheme for people below the 1 lakh earning limit, right?
So a lot of states in India had insurance for their people. Now in Goa, where I live, there is an insurance for everyone.
Okay.
Government provided insurance. All you have to do is register, and it provides a certain amount of money for certain procedures. It's also good to have your own insurance because that also helps. Maharashtra had a certain thing where they used to help people below a certain poverty line. So if your yearly earning is less than 1 lakh, then you are eligible for this particular insurance. I think Andhra Pradesh also had a similar type of insurance. Now with the Prime Minister's scheme of Ayushman Bharat, everyone in the country is eligible to pick up an insurance. And the thing about the insurance is that the way it works in present situation is the insurance is not but at least it's giving something to the patient, but it's not giving enough to the hospitals. So hospitals have to work in volumes. So they take unless there's a lot of patients, it does not work very well.
You're still saying it's going to be theoretical, right?
Correct.
Because at the end of the day, you're saying that
it's all people at the end of the day, and and how they want it to function, and how ethical they are, and
because it's not going to be automated to a level with automation that you're saying there's going to be some human intervention required even at a token level to verify, right?
So like you say automation. So first there will be a person controlled and machine supported level of automation. Then there will be machine controlled, person supported, and then will be machine controlled and person governed level of. So this is called a level 4 automation, and then will be completely machine controlled. So when we look at automation, we are not looking at automation at complete machine control, because in healthcare and even in public health, the differences in variety of information which is there and the variations are tremendous. So you cannot have one guideline which fits into everything. So you'll have a machine controlled to person governed kind of a situation where there'll be a person sitting and observing various things which are happening. So that I can envision happening very soon. And maybe in next few years you can have things which can be. Now if the government comes up with this health token, because like you said, does insurance person come up with it first, or does the government come up with it first? But I personally say it should be both, because unless there is a forced thing from the government, and at the same time
but to be truly decentralized, I think we need this DAO setup which has got representatives from everyone, right?
Correct.
Because otherwise, as soon as you start talking about governments and big pharma companies and insurance companies doing this, I think again the whole don't trust anybody attitude for which Web3 has actually come might get a little people might be feeling
but that's what I said. You cannot have it completely decentralized. You have to have it like like the algorithms are in place, the network is in place, but there should be some level of supervision, some level of regulation which is there, which will help. But having said that, we don't know how the future is going to be, but because of so much variations in medicine and in medical policies, I think it'll take a while for complete automation to come in, but it will be there to a semi-automated state very soon.
So since we're talking about terms which pretty much lead to a DAO, right? Like decentralized autonomous organization, this is just like something which I wanted to jam with you about, right? We see a lot of hospitals in India run by trust boards, etc. Do you actually see a hospital run in the form of a DAO in the future?
Definitely. I think that's going to happen. Hospitals
owned by the doctors and the people who work there, and not just like a hierarchy.
Correct.
Or a management.
But
you know where I'm coming from, right? Because a lot of people nowadays feel that hospitals care more about making money,
correct,
and less about making the world or patients
the
better.
thing is, the hospitals have been, especially private hospitals, have been put as a business entity. So their primary aim is to make money. But the whole thing about health is it's a noble cause. It is something which everyone wants. It's something which everyone deserves. So the new age hospitals should be something which will not be completely money oriented. It should be something which will help the public, help the patient to the maximum. At the same time, able to sustain themselves as well, because pure high quality healthcare is not cheap.
Yeah.
So, I've traveled, I've worked in US, I've worked in Korea. When we see the level of care which they give to a patient, that level of care is years away in India, in the periphery, or in 2-tier cities.
Why? Why? Because of a population?
That could be one of the things. The paying power is the second thing. The charges of a particular surgery there is almost 100 times more than what is is here. So that level of care and that level of precision, that level of expertise to develop also, the doctors also have to be trained so much so that they can actually perform those kind of procedures. But if there is no enough funding for these doctors to actually learn those things, then they'll be end up doing the older things only. So like, even I'll say myself, I go and learn robotics, and I'm doing robotic surgery regularly. But if the patient himself does not want to go for robotics, patient thinks that it's something which is not useful to them, then it's a failure.
Okay, why will a patient think that a robotic surgery is not useful for them?
Multiple reasons. First is
they can't blame
the cost.
Okay, I thought they can't blame someone if it goes wrong.
That's also there. Now, if you have autonomous algorithms, not in robotics but in decision making,
sure.
And let's say you put it into the computer and say that this particular thing is wrong with the patient, and it says let's come up with a solution. And computer says this is the problem, take this medicine.
Okay.
And then you take this medicine, and then you get a complication or you get some problem.
Yeah.
So now, who is at fault?
Okay.
So that's one big thing which will come in here, because when you have in healthcare, like exactly like how you say in an autonomous car, if an autonomous car goes and crashes and kills someone, who do you blame? The car, or do you blame the company, or do you blame the person who's designed that algorithm?
It's a beautiful analogy.
Yeah. So then same way you can apply it here. Who is responsible? Because in medicine, there's a lot of legal responsibility. The doctor takes the responsibility of that particular patient when something goes wrong also and something goes right also. So when it's an algorithm doing it, who will take the responsibility? So as the algorithm evolves, that's one of the reasons why I want the data to not be completely private, because the algorithm will only evolve when there is lots and lots of data.
Okay.
So they will learn from all patient data, and then they will get smarter and smarter over time. The thing about medicine is 90% of the work is fairly neutral. It falls in the like you say in the normal distribution, it falls right in the middle. That means it's common work. And then there will be 10% of work which is very uncommon. You'll have patients coming and telling you certain symptoms which you've never heard of.
Okay.
And how do you treat these things? Maybe this falls in a particular type of existing condition, or maybe something new is there which we have not even learned, which are not even diagnosed as yet. We have had patients where they had a tumor of the leg, and then his nose gets blocked, and we go and see the nose, and then there is a swelling there, and we take a sample of that, and then you realize that it's the leg tumor which has gone into the nose. It has never happened before in history.
Okay.
So
a lot of these idiopathic diseases, right, which have come up where people still don't know.
There are a lot of things where we don't know. So medicine is still evolving. There is a lot of uncertainty. There is a lot of information which we don't know how to deal with it.
Okay.
So we've had patients where They have had one cancer, they got operated, and we have done something called as a flap. We've taken tissue from some other place, put it in some other place. Now this tissue from some other place develops second cancer.
Okay.
This is extremely rare. But it has happened. Now, there is no guidelines for this. There is no way algorithm will able to know what can be done further. But that's how I think we are going to evolve. We are going to, all these rare things also has to come as data into the central database. Then only it can actually, there'll be a lot of information in India. India is having such a population that it can provide the world with so much data and so much new things are how to treat certain things. Because there'll be such rare things which a population in Europe will never have seen.
Probably, yeah.
Yeah, and then from India, you'll able to.
Yeah, that's why I think, since we have so many people and we might have so much data, can actually pioneer this entire...
So as a cancer specialist, I have seen patients who have got 6 recurrences. Seven times. So he's been operated 7 times and he's got the cancer coming back every 6 to 8 months or maybe 1.5 years. He's got cancers coming back. And if you go and check literature, there hasn't been any patient like this. So this is a thing which should come into the literature, where then the algorithm will say, okay, this has happened previously and this has been dealt with in such a way. Then next person who comes in, we can say it's to be treated like this. That's the reason that information should be there.
So true. Mm-hmm. Pawan, I'll pivot to a slightly softer conversation right now, right? We'll go back into medicine because I have something which I want to chew your brains on. But Pawan, you're married to a pediatric ophthalmologist. She's also an influencer and content creator. You yourself you still play cricket, right? And you love sports. I wanted your take on what is happening. Like, are you aware of what is happening in the Web3 NFT space outside medicine, right? Like when it comes to sports and NFTs, did you hear any of our episodes? And like, what is your non-medical take on the metaverse and Web3?
I think that's the future. The metaverse is definitely the future. And we have people who live in isolation, who don't connect so much to real people, but and through the metaverse you can connect to so many things. You can connect to people so much far away. I think that's really a game changer for people who are and I think you must have seen that movie Ready Player One.
Yeah, of course.
So it was brilliant. I would say I read the book as well.
Okay.
And the thing was brilliant. There's something called as Oasis, which is like like synonymous with metaverse, and everyone is there. There are classes being held, there are games being played. You can go to any class, attend, go to a different planet. You can do so many things. So I think that's going to be the future. I think going to be, the future is going to be excellent.
Okay, Pawan, I'm going to put you on a spot, right? Like I was speaking to a friend who is also a surgeon, and he said, "Yaar, eka 15-20 saal mein na, no surgeon will be doing surgery." Okay. And tying this into a question which I ask a lot of our guests is 10 to 15 years down the line, right? What are the jobs in the healthcare, medicine space, health tech space right now, which will really do well? And what are the other spaces which probably might not do well? Like we were speaking, like probably radiologists, etc., right? Like they might get affected.
It's actually, if you go to see right now itself, there are so many algorithms which are doing diagnosis for radiologists. So basically, computer vision is getting more and more sophisticated and advanced. So it's not far away. I will say that it's not far away within maybe in 10 years where computer vision algorithm will directly diagnose a radiological X-ray or radiological scan. And anything dealing with computer vision, so all those fields, like let's say dermatology, for example, where you have to see a condition on a patient, on a skin, and then diagnose it. This can be done completely by a computer vision algorithm. So what will
dermats do? Only cosmetic surgery?
These are the things, yes. So there are things, that's what radiological professions is one of the highest at risk with
but it was
automation.
Highest paid, right? Like radiology. I remember when my sister was studying, she then came when you were at probably Tata Memorial. Everyone wanted to be a radiologist, right? Because highest paid. So you're saying like their jobs are in threat?
In risk, yes. Radiologists and dermatologists are at highest risk. And then followed by
surgeons because of surgery?
Surgeons are at not that high risk, according to me. And I'm being a surgeon myself, maybe I have a bias, but according to me, because every single surgery which we do, there is a little different thing which we do.
Okay.
So it's not the same thing. It's not like the movement of the scalpel, the bleeding, the patterns in the patient, the anatomy of the patient is slightly different. So I see that happening in the future, where the surgical procedure steps are fairly uniform. Let's take a cataract. The steps are fairly uniform in many ways. So I think an autonomous machine which can remove the cataract can come definitely very soon. But if you say a person removing an abdominal tumor, every tumor is different, every anatomy is different. So the same pattern cannot be replicated. Having said that, with robotics, what is happening is all the information which the surgeon is seeing is recorded. Now we don't know how an algorithm might function. So if you put all the surgeries done by a robot and then you run a learning algorithm on that, machine learning, maybe you'll get certain things which needs to be done in a particular surgery where it can be automated. So maybe certain steps can be automated initially, not everything. And let's say the skin cut can be automated and the skin stitching can be automated in the end. So that can move up, and then slowly it will do the advanced steps. But I don't see that happening very soon. I think it's quite away.
Okay.
But
you're saying for every surgery, you will still need someone who guides the surgery, right? You'll still need like a maestro of the ceremony.
Correct.
Who's basically saying...
Correct. Because there are a lot of factors which play in a surgery. Now, not just like we don't look at a human being just as a body. There is also a alive human being. So there's an anesthetist who's actually controlling the patient parameters. Patient is moving. There are breathing patterns. So anatomy also is changing. All these things will play a role. So
what about like, especially in the future, right? You think stuff like forensics and all that people will really get into? Because I think blockchain apparently is, many people say, will reduce crime, right? Because it might get so transparent, but also at the other end, it lends itself to anonymity so much, right?
Correct.
So how is this space going to evolve?
Anything that's online is going to be reduced and traceable.
Okay.
But offline, how do you control it? So
true.
I think that's the offline crimes. I think will still continue.
No, but if everyone has their health electronic ID, which you said, right? Mm-hmm. I think it's going to become a little more trackable. Yeah, and I think
it's still trackable right now. I think all of us has phones, all of us have Aadhaar, so we're still trackable. But with health, you'll have their health data available. But I don't see any right now. I don't see any negatives in that. The negatives could be very less, but the positives can be significantly high. But again, it's about patient's sensitive data and patient's consent, whether he actually wants to share. But I personally feel if you can anonymize the data, it should be in the open domain, right?
So, Pawan, lastly, right? Like you are, of course, a full-time head neck oncosurgeon, and with a love for technology. But you've also dabbled in this technology space a while, right? You've done some work in this space. So please tell us a little more, and also what are your visions for the future in this tech space?
I, along with my other doctor colleague, we worked on a product which was dealing with adherence.
Okay.
So just overview of that is that we had developed along with a AI person an algorithm which can identify the tablets which you're taking. So the idea was that to track whether he's taking the medicines on time, and instead of somebody neutral person taking, the algorithm will check whether you have taken the tablet. You just put a tablet in the hand, show the camera identifies that this tablet has been taken. So that way we were planning to track his medicines, and it's not that we were planning to track his medicine, that the patient himself can track his medicines and see whether his adherence score has been maintained. It was called Kite Adhere. So it was an interesting thing which we are working on. We're still working on it.
Okay. But what are the other things which really get your fancy, right? Which you would like to be involved over the next few years?
So big data is going to be huge. So according to me, coming up with newer guidelines and newer solutions for for health problems is the next thing which is going to happen. Genetic space is going to go out of the. It's like it's going to blow out of proportion. So,
but there's been still. I've been hearing this for 20 years, right? Like I told you, CRISPR and genetic stuff was one of the first reasons why I entered the biotechnology space. But yeah, there have been conversations about against the will of God, ethics, and should you change?
Like they say, survival of the fittest and Darwin. So now
that'll change, right? People are saying
that will change with the ability to control. Even the genetic code, the code of life, you can actually control so many things. Now with even longevity, now there have been tablets and medicines discovered which improve the health span in test subjects, not in patients per se. Patients trial will take a lot of time because to actually improve a lifespan of a human being, the study should run at least 200-300 years. Yeah. But to actually do it in like they have done it in something called as naked mole rats.
Okay.
And certain medicine
increased life expectancy by how long?
Increased life expectancy by 40%, 30 to 40%.
Are you saying we are going towards immortality?
That's
and then actually thing. Black Mirror stuff where consciousness gets uploaded.
That's the next thing. So I see. According to me, like a lot of people will contradict this and say, "Okay, why do you want to live for long?" So and you'll get old and then you're going to be crippled. And why do you want to live long? My point to counter this is you want to live healthy.
Yeah.
You want your healthy span to become longer. So, that's the aim of, longevity. So, I think in future we are going to live longer and healthier lives rather than just an old guy living for 110 years
in the bed. That's just increasing your suffering.
Yeah.
Right?
So, we don't want that. So, we want to be a healthy person. And according to me, the root cause of disease is aging.
Okay.
The root cause. If you don't get older, you will not get heart problems, you will not get blood pressure, cholesterol. You don't see that commonly in a 20-year-old. You see that in a 50-year-old. Why is it in 50-year-old? Because it's got older. So as age progresses, there are a lot of problems happening in your body. And if
a lot of technology is also happening where primarily people are working on age reversal.
Yes. Medicines are one. Then they are dealing with
or in the metaverse, though, you can just say that you're 20, right? And someone will believe you.
With avatars, you can be anything. But in the real life situations now, they are 3D printing hearts, 3D printing kidneys. So the need for new organs that's going to end very soon, according to me. We'll not need a person to donate you organs.
So these organ farms and all,
you just have to tell what is your genetic code, and that will be printed, and then you'll be taken. Stem cells will be taken, and you'll be 3D printing your organ and putting it back into your body. Did you hear recently about that pig heart put into the human being?
Tell us more.
Yeah. So the transplantation, like the pig genetics code actually closely matches human code. So the rejection rates are a little lower. So you cannot you can't cross transplant anything into a human being because there is a lot of rejection which happens. Even when you put it in from a different person, there's a rejection which happens. But because a pig's heart closely resembles a human heart, and it also has a matchable genetic code, they have done this in a human being, and it worked. It worked for a while. So the test subject didn't live long. I mean, I'll not say, but that's a start. That you can actually transplant a pig heart into a human being. So
wow. On that note, Pawan, that was such a fascinating conversation. Any last shout outs to any podcasts which you listen, or any stuff, or any online resource where if someone is curious about this whole world of healthcare, health tech?
I'll say about books, because according to me, for a person who is actually looking to be healthy, so first and foremost, a book written by an author called as David Sinclair.
Okay.
So it's called as Lifespan, and it's an excellent book, and it's about how we don't have to grow much old, and there are a lot of research going into it. He's a Harvard professor. And even for that matter, Tony Robbins has come up with an excellent book called Life Force, which again is delving into all the things which can be done to keep yourself healthier, and all the latest technologies which are there. So the future is going to be, future is here. Future is already here. And that again quote William Gibson, I think, that the future is already here, but it is unevenly distributed. That means everything is already there at different places, but it's not easily available and easily accessible. I think that would be my last statement. Yes.
Thank you so much for this conversation, Pawan.
Yes.
Thank you so much.
Thank you, Eka. Thank you for having me. Yes.
And that was such a fantastic episode of Future Proofing presented by Intel vPro. If you learned a bit from this episode or really liked it, please like it, share it, comment on it, rate it, and share it with all your friends in this space. We also have some really cool news for you. We've got this contest running, free NFTs every week. For more information, do follow IVM Podcasts at IVM Podcasts across all social networks. Do also drop me a follow. I'm at Ekalavya across Instagram, Facebook, LinkedIn, and Ekalavya B on Twitter. Thank you so much.